Welcome back to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Today, I want to take you into a world that sounds almost like science fiction, but is very real and very relevant if you're living with diabetes. Imagine your dog, your loyal, cuddly companion, sensing a dangerous drop or spike in your blood sugar before you do. It sounds incredible, right? Well, it's not just a cute story. It's something that's happening today, and we're going to explore how, why, and what it means for you. By the end of this video, you'll have a clear understanding of how dogs can smell changes in blood sugar, the science behind it, what the real limitations are, and how this knowledge can help you stay safer and feel more empowered. So stay with me. Before we dive deep, a quick disclaimer. I'm not a doctor, and this video is for educational purposes only. It's not a substitute for medical advice, diagnosis, or treatment. Now, let's get to it. Segment 1. The Canine Nose, Nature's Supersensor. Let's begin with the first question. Why should dogs be able to detect anything unusual at all? The answer lies in their biology. Dogs have a sense of smell that is orders of magnitude more powerful than ours. They have many more olfactory receptors, a much larger surface inside the nose devoted to scent, and brain structures optimized to pick up subtle odor changes. When human bodies shift into abnormal metabolic states, like very low or very high blood sugar, they release tiny chemical changes, compounds in sweat, breath, skin, or even changes in one's physiological odor profile. Dogs can sense those. According to the University of Cambridge research, for example, a chemical called isoprene was found to rise in the exhaled breath of people in hypoglycemia, and researchers believe dogs may detect that shift. So yes, dogs are biologically equipped to pick up cues we cannot. That sets the stage for why this works at all. Segment 2. What's going on with diabetes and scent? Next, we ask, what exactly are dogs smelling, and when does this happen? In diabetes, especially when blood sugar drops low, hypoglycemia, or sometimes when it rises too high, hyperglycemia, the body's normal biochemistry changes. Metabolism shifts. In the case of hypoglycemia, your body may ramp up processes that produce volatile organic compounds, VOCs, chemicals that evaporate and release into breath or skin. There are also changes in sweat, skin smell, or even subtle changes in behavior or exhaled breath. A study noted that when glucose levels drop in people with type 1 diabetes, the dog's sense can detect the scent of sweat alone, in some cases identifying hypoglycemia samples. However, and this is important, the exact smell signature that dogs detect isn't completely mapped out. The science is still developing. Some studies show good performance, others less so. For example, one controlled study found trained dogs were largely unable to identify skin swabs from hypoglycemic subjects at better than chance levels. Segment 3. Train diabetic alert dogs in practice. Okay, so dogs can smell something. But how does that translate into real-life service dogs for diabetes? There is a category known as diabetic alert dogs or glycemia alert dogs. These are dogs trained to monitor their diabetic partner and alert them when blood sugar is getting dangerously low or sometimes high. Research shows that these dogs, when trained, can have fairly strong sensitivity and specificity. A review found sensitivity ranging from 22% up to 100% and specificity from 71% to 90% in different studies. Another study of 27 dogs from a UK charity found median sensitivity to hypoglycemic episodes of roughly 83% and positive predictive value, PPV, about 81%. What does that mean in practice? It means many trained dogs can reliably alert when a person's blood sugar is out of range, potentially before the human notices symptoms. For people who have hypoglycemia unawareness, i.e. they don't feel the warning signs, this can be life-changing. So the bottom line, this is a powerful tool, but not a perfect replacement for monitoring your blood sugar. It's an addition to your toolkit. Segment 4. The science behind how they do it. Let's dig a little deeper into the how. When we talk about dogs smelling diabetes, what chemical cues trigger them? As noted earlier, research points to isoprene in the breath during hypoglycemia, but that's likely just one piece of the puzzle. There are also volatile organic compounds from fat breakdown, sweat changes, skin-emitted compounds, and possibly ketones in situations of high blood sugar or diabetic ketoacidosis. And dogs may not only detect odor, they may also pick up behavioral or physiological cues, shaking, sweating, changes in breathing, though the goal of training is often to isolate scent alone. Some studies show dogs succeeded using only scent, skin swabs, to identify hypoglycemia. And why is this possible? Because dogs' olfactory system is tuned to detect incredibly low concentrations of odor molecules, far below what humans can sense. Their training, reinforcement, and maybe even their bond with the handler enhance this capability. So the science is that the diabetic person's body emits distinct chemical markers when blood sugar is disturbed, and dogs can pick those up. But exactly which chemicals and how uniformly they appear in different people or different scenarios is still under study. Segment 5, the fruity smell of DKA. Now that we've talked about the science of dogs detecting low blood sugar, let's shift to another major piece of the puzzle, diabetic ketoacidosis, or DKA. This is one of the most dangerous emergencies a person with diabetes can face, and believe it or not, dogs may be able to detect it too. You've probably heard that DKA can make the breath smell fruity, almost like overripe apples or nail polish remover. That smell comes from a chemical called acetone, one of the byproducts of the body breaking down fat for energy when there's not enough insulin available. In this state, glucose can't get into the cells, so the body starts burning fat for fuel. As fat breaks down, it releases ketones, chemicals like acetoacetate, beta-hydroxybutyrate, and acetone. When ketones rise too high, the blood becomes acidic, and that's when DKA becomes life-threatening. Here's where dogs come in. That fruity smell you might barely notice? For a dog, it's like a blaring alarm. Acetone has a strong odor signature, and dogs can detect it at incredibly low concentrations. We're talking parts per billion. Several studies suggest that dogs trained for diabetic alert can sometimes pick up early signs of DKA through these acetone emissions, even before a human notices symptoms like nausea, confusion, or that telltale smell. In other words, they can alert their owner to a metabolic crisis before it spirals out of control. Segment 6. What this means for people with diabetes. Now let's bring it home. How does this topic matter for you, living with diabetes? First, awareness that this capability exists is helpful both psychologically and practically. If a dog, yours or a trained one, can alert you to changes you may not sense, that can reduce risk, increase your freedom, and improve quality of life. For folks with hypoglycemia unawareness, this is especially valuable. Second, it doesn't replace your current monitoring tools. A dog can't measure your exact blood glucose or ketones. It can't replace a CGM, your meter, or your insulin plan. It adds a layer of protection. Third, if you are considering a diabetic alert dog, you'll want to ask questions: training credentials, how long the dog has been placed, the alert reliability, costs, maintenance, and your own readiness to work with a service dog team. Fourth, even if you don't get a service dog, you can still benefit from the underlying science. Increased awareness of physiological shifts, exploring breath or sweat testing devices in development, and monitoring your body closely. And fifth, know the limitations. While many alert dogs do well, they are not perfect. Some dogs miss events, and not everyone is a good candidate for a service dog. Training, cost, lifestyle, and dog handler partnership all matter. Also, most research is heavier in the hypoglycemia, low blood sugar area rather than hyperglycemia, very high blood sugar. So dogs may detect lows more reliably than highs. And remember, because we don't yet know definitively which chemical markers dogs detect in every scenario, you should treat the dog's alert as an early warning, not a definitive diagnosis. For you, as someone living with diabetes, knowing that this capability exists adds another dimension to your self-care. It reminds you you're not alone. There are backup systems, and new technology is emerging based on what dogs can already do. Thank you for watching. Are you partnered with or have you met with a diabetic alert dog? We'd love to hear about it. Comment below. And please share this video with someone who needs it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.